this lesson, we're going to take a look at some basics in documenting care. When we talk about documenting anything in the patient's record, we need to document objectively. So what do I mean when I say document objectively? Well, you want to document only what you see, literally only what you see. Don't document what you speculate or what you think is happening, only document what you see. If your patient falls out of bed and you come in and you see that they're on the floor, you've assumed that they've fallen, and the patient says, I fell out of bed. You would not say patient fell out of bed, because that means that you actually witnessed it. What you do want to say is observed patient on the floor, patient states, I fell out of bed, which kind of leads me to my next point. We're just talking about subjective data. You want to use quotes when we're talking about what the patient says. So the patient could say, I feel or I experienced, I fell out of bed. So you would say, patient states, fell out of bed. The other thing that you want to do here is you want to make sure that you're clear, that you're concise, and you're complete. Don't ramble, make the point, and then move on in your documentation. Only include the information that you witnessed, and that's important. Another thing we want to look at is being reflective of the nursing process in your documentation. So go check out the nursing process lessons so you can get a refresher on the types that we use. So ADPI, API, SOAPI. These are all acronyms that help guide the nursing process, but they'll also help you guide your documentation. So be reflective in that. So here's an example. Let's say you have a patient whose blood pressure is elevated. The first thing you would do is say, the blood pressure is high. Then you would notify the doctor. Then you would say, new orders received. Then you would say, gave medication per EMR. And then you would say, we'll continue to monitor. Right? So what you've done here is, this is an example. You've used the assessment portion. You've analyzed that your patient needs medication. So you've taken the steps to get new orders, because that's your plan. You got the new medication, you gave it to your patient, and then you've implemented it. And now you're going to evaluate by following up. So this will continue to monitor. So that's how you use the nursing process in your charting. The next thing you want to do is you want to be sequential. You always want to chart things in the order that you give in patient care. You wouldn't say that you change linens and then give the patient a bed bath, because in reality, you would actually give the bed bath first, because the linens are wet. Then you would change them and give them fresh linens. So don't skip around, because you could actually falsify your documentation. So you always want to make sure that whenever you document, that you're actually showing that you rationalized it and you use the nursing process, because you would say, I did this, and then I did this, and then I did this, because, and your documentation should reflect that. When we talk about signatures, a lot of electronic health records have automatic timestamps in them. If your system has it, then that's awesome. But if they don't, then what you want to do is add a time date stamp to when you gave care. And you also want to chart as close to real time as possible, so that we don't have gaps in memory, which will contribute to errors and omissions. The other thing that you want to do when you chart is you want to make sure that you sign and date everything that needs it, and sign legibly, so then they know what signature and whose signature that is. You also want to sign and initial everything that needs it, so that you show that you're approving your documentation. Okay, another thing that you want to do when you're charting is you want to make sure that your charting is legible. It's great as technology is. Not everybody and every hospital and every facility has switched over to the electronic health records. And so you want to make sure that if you're using paper charting, that you're writing neatly and they're using blue or black ink. Something needs to be photocopied and you're using something like pink or purple. They're just not appropriate ink colors. Some facilities will request you to use red ink for acknowledging provider orders on paper, but otherwise it should always be black or blue. Also, when we're talking about documentation, we want to talk about using abbreviations that are either facility approved or like Joint Commission approved. The Joint Commission has something called the do not use list. There's a link attached to this lesson for it, so go check it out. But what happens is some abbreviations can be confusing. So what you want to do is you actually want to avoid confusion by not using medications, or I'm sorry, abbreviations that are on this list, or abbreviations that could potentially be misunderstood. So if you're concerned about something not being clear, just type it out or write it out. Another thing that I want to talk about is something called charting by exception. And you'll hear tons of it when you're talking about documentation. So what is charting by exception? Charting by exception is a quick way to chart. It's essentially a shorthand. What you basically want to do is chart only things that are abnormal. For example, if your patient's lung sounds are clear, you don't have to document lung sounds are clear. You can, there's already an assumption that they are clear, and you're only going to have to document things that are abnormal. Normal values are also always defined, usually by facility policy. So check with your facility. And you also want to check with your facility whenever you are looking at what rules are applicable for charting by exception. Some say that you have to document WDL within defined limits in your first assessment, but all of the assessments can be left blank because they're still within defined limits. So the big takeaway here is you actually want to make sure you follow facility policy when we're talking about charting by exception. When discussing the basics of charting and documentation, we look at these nursing concepts. So communication and also health information technology. Okay, so let's recap. Number one, document objectively. You want to document what you actually see. Be reflective in your nursing process so that it reinforces your documentation. You want to be legible. You want to make sure that you're using the approved abbreviation and that you're writing legibly, including your signature. Also, make sure that your system has a way to sign, date, timestamp, everything. If it doesn't, then make sure that you sign and date your documentation to reinforce that you've approved your documentation and that it's all correct. Lastly, charting by exception. Use charting by exception to document quickly and make sure that you follow facility policy when you have to. So that's it for our documentation basics lesson. Make sure you check out all the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.